Hi, I'm Zach. I'm a senior athletic training student at FGCU, and today I'll be performing a Voms concussion assessment. So first thing, you want to get a baseline of the symptoms that the patient is experiencing. They're gonna rate these symptoms on a scale from 0 to 10, and that's headache, dizziness, nausea, and fogginess. With these tests, you want to find if you find any abnormal findings or any symptoms that get provoked, you should refer them to a health care professional. So the first test is going to be smooth pursuits. It's going to be testing the ability of the patient to follow a slow-moving target. The patient is going to be instructed to focus on a target as I move the target in a slow manner. So we're going to start in a horizontal. You're going to follow this. Adjust your eyes. And then we're going to go into a vertical. Okay. And then they would record any symptoms. The next is going to be saccades, and this is going to be testing the ability for the patient to move their eyes quickly between targets. So we're going to take these two popsicle sticks. I'm going to have the patient hold both of them for me. Here. And they're going to be going from both target back to back, from one to the other and back to the starting one. That is considered one repetition. The patient's going to be doing this as quickly as possible. They're going to do it 10 times and go. Okay. Next we're going to do a vertical saccades on that one, so we're just going to move them here. And they're going to repeat the same thing. And go. Alright. The next test we're going to do, you can relax, is convergence. This is going to be measuring the ability to view a near target without double vision. So the patient's going to be sitting and they're going to focus on a small target, the point, as well as measuring how close they can reach their nose. So they're going to take this one, hold it up against their nose, and then you're going to hold this one as well and slowly bring it closer, and once you reach double vision, you're going to stop. Alright, and since they're within, a normal setting for this one is going to be within 5 to 6 centimeters, and for him he is, and they are going to repeat this 3 times. But for the video, we don't have to. Next is going to be the vestibular ocular reflex test. This is going to be assessing the ability to stabilize vision as the head moves. So for this, we would also use a metronome, but I do not have one right now. So they're going to hold this as far out in front of them as possible, and they're going to horizontally rotate their head back and forth around 10 times for about, with the metronome, it'd be at 180 beats per minute. One repetition is going to be back and forth, back to the starting position, and let's just go as fast as you can. Alright, and stop. Next is going to be the vertical VOR test. So they're going to be going up and down with their head as fast as they can at the same 180 beats per minute 10 times. Go. And stop. Alright. And again, they'd still record any of the signs and symptoms after. The last test is going to be the visual motion sensitivity test. This is going to be testing their ability to inhibit vestibular-induced eye movements using vision. So for this one, the patient is going to stand up. So if you can stand up for me. They're going to hold out their arm as far away as possible with the popsicle stick and focus on it. We'd want to try and have a busy crowd in front of them, so they just focus on this. The next part, they're going to move to a metronome of 50 beats per minute. They're going to go into the front, to the side, back to the middle, and then to the other side. And go. And stop. They would do this about 5 repetitions, so once would be back to the middle from both sides. Again, they would record headache, dizziness, nausea, and fogginess after, and if anything is above a 2, that would be considered a red flag for concussions. And that is my Voms test.